get started. Okay, namaste everyone. Thank you so much for joining. Huge pleasure here to have Palak with us, and Palak's going to lead a session on yoga for women's health. Palak has been doing yoga since childhood in India. She's a practicing physical therapist and working with musculoskeletal issues. Some of these words, Palak, that you're an expert of, I'm having trouble even pronunciation. Um, and she is deeply inspired to become a yoga teacher to help individuals maintain strength, flexibility, and overall quality of life. She holds a doctorate degree in physical therapy, and her specialty is working with people who suffer from vestibular and balance disorders. She has special interest in pranayama and breathing exercises, and truly believes that it has great benefits uh, for mental health and immunity. So, with that introduction, over to you, Palak. And looks like you have a couple of screen shares. So, let's do that here. And thank you for your service.
Thank you. Thank you for kind introduction and giving me this opportunity today. So I am going to go over a little bit of pelvic health. Now, um, I would like to know from, I guess there is Sushma Indirani, and I don't know who is AK, but do you guys have any information on pelvic health?
I do not, I must mention.
Okay, so that's a good opportunity here. I also treat pelvic floor related disorders, and I use yoga every day with my patients, and it's amazing how much that can be beneficial for all the women, not only in their later stages of life, but also from the beginning of their life. Disorders like PCOS, issues with menstruation, pain, cramps, pre-pregnancy, post-pregnancy, prenatal, postnatal, and then also when you go into perimenopause and menopause and how the whole tissue structure changes for you. So for that, I'm gonna go into a little bit of anatomy, like how our body looks like down there, so we get an idea what we are working on. So I'm gonna share my screen. All right. So what you're looking at is uh, a top view of your pelvic floor. Now, when I say pelvic floor, it's composed of like your two big hip bones, your tailbone, which kind of holds the whole structure together. And what you're looking at is you're looking on the from the top part, and where you are looking at, so this is the front part of your pelvis, and then this is the back part of your pelvis. And then the holes you're looking at, the first hole is where you have your urination happens from there, urination, and then your vagina sits behind it. And then this big one is the one where your colon comes out, and that's where you poop from. Now, if you look at it, the whole structure is like a hammock, and it kind of holds all the organs like bladder, bladder, your uterus, and your rectum, and your big intestine. I don't know how to go to my next slide. I'm sorry, I'm not very savvy. Okay, I got it. Okay, so this is from the side view. If you look at it, this is the front here, the pubic bone. Then you see this is your bladder.
I never knew. I have not registered.
Do you mind putting yourself on mute? Okay. Okay. So the behind the bladder is your uterus, which is kind of looking like an inclined in between. And if you go behind is your rectum. So the way they look like here, they are not like that. They are very in a squish position. They are all like attached to each other. So if they are not, and then you see this big line, the pink line over here, which holds all the structure in place. If that hammock kind of structure, which says here pelvic floor muscles, if they are not holding everything right, you may end up into incontinence, leakage when you laugh or cough, little pee comes out. Your uterus sometimes prolapse, and then problems with constipation, problems with pooping or diarrhea, or so there's a whole lot goes into this area. And many times I feel like women are led to believe that a little bit to hota hai, you have that, it's normal to cough and laugh and have a leakage happen to you, but that's not normal. All right, this is another picture from the, sorry, this is another picture from the top, where you can see the muscle it's like up there. So you can see that hammock holding everything in place. So how our pelvic floor and our body actually works. So we have, I'm gonna go behind a little bit just to explain a little bit better. So you have your diaphragm sitting here on the top, and if you look at down, you have your pelvic floor muscles all the way. So it's like a closed cavity, right? In that cavity, you have your stomach, you have your liver, you have your intestine, you have your bladder, bowel, you have your uterus, all the structures, spleen, your kidneys, everything sits in this small area. Now, when we breathe, what happens is our diaphragm comes down. So I inhale, if you inhale, you will realize you go, inhale, your diaphragm comes down. Diaphragm is a big dome-shaped muscle which helps the breathing. So it goes up and down. When we inhale, it goes down. We exhale, it goes up. So the whole thing, it goes like up and down when we breathe. Now, many times when you have this down part, the pelvic floor, it doesn't go like that, but it goes opposite. And that causes dyssynergia, meaning your muscle doesn't know what to do. And that can cause issues. So when we inhale, the diaphragm comes down and your pelvic floor goes down, and it should relax. And when we exhale, it goes up, everything goes up. This is the movement should happen. Even we do any breathing and even we do our yoga poses, it should go like that. So that's a very basic thing. And if you have any questions, I can answer, and then we can go into all the pelvic floor related poses and some breathing I'm going to show you. All right, so I guess nobody has questions. So we're going to get into, you guys hear me okay?
Yes,
All
Palak.
So let's go ahead and we're going to do some deep breathing. Now, just try and breathe with inhale, long exhale. So you go inhale, and then you go exhale. Inhale and exhale. And one more time. Inhale and exhale. Now we have known a lot of different types of breathing, diaphragmatic breathing, the chest breathing, all these different pranayamas. But when we are really working with our pelvic floor, we want to think about our 360-degree breathing, meaning our chest, front, side, and back. That all should expand together and relaxes together. So, and while that happens, your belly should come out and in together. So you put your one hand on your chest, one hand on your belly, and you're gonna go inhale and you go exhale. So as you see, my chest rising and my belly rising together. And when I'm exhaling, everything goes back. So this is a basic thing you should be able to do. Now, when I'm going to tell you to inhale, think about your pelvic floor. We go inhale. Think about all the air going all the way into your bottom, and you're relaxing your vagina, you're relaxing your pelvic floor muscles, your butt, because it's very interesting that when we work, we do things, we carry our tension on your shoulder. As much as we carry tension over here, we carry tension in our butt and our pelvic floor, because we knowingly, unknowingly, we clench. Whenever we have like something going on, we clench. And what that does is everything is tight there, and which eventually makes it weak. So it's very important, as much as we want to contract, we want to relax. So we're going to go ahead again. We're going to have our one hand, chest and belly, and we go inhale and exhale. Inhale all the way inside, all the way belly and all the way down into your pelvic floor. And then exhale and try and squeeze a bit when you exhale into your pelvic floor. Just a tiny bit. Okay, let's do 5 of them. Inhale, relax, exhale, squeeze. Inhale, relax, exhale, squeeze. Inhale, relax, exhale, squeeze. Inhale, relax, exhale. Now you get the idea how we squeeze our pelvic floor, how we squeeze our bottoms, right? So we have our urethra where we pee from, we squeeze that. Then we have vagina and the entrance of vagina, that's where we squeeze. And then we squeeze also from our butt. So we want to also learn to squeeze all together, as well as we want to learn to squeeze individually. So I can't see what you do, but go ahead and try. That you're going to squeeze in the front. You will see that you will not be able to do right away. So you're going to squeeze in the front, then you're going to squeeze in between, and then you're going to squeeze your butt. And then again, front, middle, and back. Just get a little practice there. And every time we squeeze, we want to relax in the end. So now we're gonna squeeze our bottom, and then we're gonna think. You all must have heard of Kegel, right? And then in yoga we do bandhas, right? Mool bandh. So you're gonna inhale, and then when you exhale, you're gonna bandh. You're gonna close your bottom, and you're gonna think of an elevator going up from level 1, level 2, and level 3. And then you're gonna come down level 3, 2, 1, and completely relax. Completely relax. One more time, we're gonna do the bandh. Inhale, and then exhale and squeeze. And you're gonna go up on the elevator, 3, 2, 1, 1, 2, 3, and relax. So this is a very good practice to have. So you always know, sometimes people have, when you have to go out, you're like, oh, I have to go. I don't want to go anywhere else. And then I have to run. So at that time, people cannot hold it. So this little squeeze, if your body knows, if you do just 3 or 4 squeeze, you can just make it go a little longer. You can hold it a little longer. Your bladder has a capacity to hold water, like 2 cups of fluid in your bladder. So many times we think that, oh, let me just go right now, and then if we're going somewhere, we go, oh, let me go again. That's not a very good practice. You want to keep your bladder full. You want to make it learn how to keep it full and not leak. So that's one thing you can remember. All right, so the next, we're gonna go into circles. So you're gonna feel your hips on the floor, the butt, like your lower part of the butt, you feel grounded there, and then you're gonna go into circle. So you're gonna go front and back and circle from your left side or right side, whichever you like. So when we come in the front, we go inhale. When we go back, we exhale. Inhale, exhale, inhale, and exhale. And one more. Inhale and exhale. So what you're doing is you're moving your spine over your tailbone. So that kind of helps to mobilize that part of your lower back, your pelvic floor. Now we're gonna go opposite. You're gonna go from the other side. Inhale and exhale. Inhale and exhale. Inhale, exhale. Inhale, exhale. The last. Okay. Now we're gonna go into I'm not gonna talk about all the poses, their names, but they are all yoga poses. I can give you the names later. So what we're doing is we're spreading our legs out. And if you think about this part, the our inside muscles, they are mostly tight because we always sit with our feet together. And to stretch them, that is very important. And these muscles, believe it or not, they go inside, all the way inside of your whole pelvic floor. So this is a very important asana where you sit with your feet apart and then you feel that stretch going in your legs. And let's do 3 deep breaths here. Inhale, and you will see in the position like that, your breathing changes too because of the stretch. Inhale, inhale, and exhale. One more. Inhale. The second asana is butterfly, where we're gonna bring both feet together. This is again the same thing. You're stretching all the muscles, all the bottom muscles there, which is always clenched when we are sitting and we are stressed. So go ahead, move that up and down. 2, 3, 4, 5, 6, 7, 8, 9, 10. We're gonna bring our legs straight in front. Again, the same thing. Your lower back stretches, your hip stretches in this position, your hamstring, the muscles behind, they are very important to be stretched in this position. We sit in the chair most of the time, so we don't get to stretch this a lot with women because our back gets tight. So hamstring, these muscles, and your lower back is connected. Very important asana. We're gonna do 3 deep breaths here. Inhale and exhale. Inhale, exhale. Inhale, exhale. Now, if you can always go forward and stretch a little bit, but you can always start here. The next asana is we're gonna sit on our feet, our ankles like flat, Vajrasana. Right? This asana is very important for digestion, breathing, and your pelvic floor, all of it, even if you just sit like this. The and so that's where you start, and then we're gonna put our 2 feet in our belly, and then we're gonna inhale and exhale and slowly go forward. And feel that little bit of massage in our belly. We're gonna come up. Inhale and exhale. Hold it and come back up. One more. Inhale and exhale. And come back. So in our belly, there is a lot of tightness we develop because of our stomach irritability. People with celiac disease, irritable bowel syndrome, endometriosis, all that causes a lot of adhesions between your intestine and all the organs. And this one pose actually helps to massage that on your own. So very good pose to do if you have belly cramps during menstruation or otherwise. It really helps. Even this also helps with constipation. So you're putting that pressure. Okay. Now we're gonna go on our hands and knees, and once we situated our wrist right below our shoulders, and then hip and knee align, we're gonna go into cat and cow. So again, this is moving your pelvis up and down. So you're gonna start with going up, inhale, and down, exhale. Up, inhale, and down, exhale. Up, inhale, and down, up, inhale, and down, exhale. From here, we're gonna go into child's pose. Bring your knees apart, and you can leave where your heels are, and then try to sit down on your feet, stretching your hands out in the front, and feel that stretch in your buttocks, your hamstring, your front of your thigh, back of your thigh, shoulders, and 3 deep breaths here. And you can come back. And feel the pressure in your hands. And we're gonna go back again. Sit back and feel that stretch in your buttocks. Open up your hips and your back. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. We're gonna come back up. And now we're prepared to go on our back. Right, we're gonna start with happy baby pose. So what we're doing is we're gonna try and hold into our toes and open our lower part, our butt muscles and the lower back muscles. This actually stretches out the whole pelvic floor. And this should be a routine for every woman because we carry so much tightness there. Open, hold it. Couple of deep breaths here. And then bring it back down. If you cannot go all the way up, you can always hold it behind your knee or thigh and stretch it out and open it up. This is the position we deliver babies. So that's where everything stretches out and relaxes. Inhale, exhale, a couple of them. And then we're going to bring it back. The next one is rotating your knees side to side. It again stretches your lower back, your hips. So we're going to go back and forth, side to side, 5 times. It's 1, 2, 3, 4, 5. Bring both knees to your chest and just turn side to side. Feel that massaging your lower back. It feels really good. Right. Now we're going to do butterfly here. You're going to open up both legs. In the butterfly pose. Really good relaxing breathing here. Inhale the way we were doing it before, all the way into your vagina. Inhale all the way down and relax all the muscles down there. And then exhale through it. Inhale. Exhale. Inhale. Inhale. Move knees up. We are going to go into bridge pose. So your arms kind of try to hold it onto your knees, ankles. If you cannot, like this, if you cannot, put your hands on the side. And then we're going to go up from your hip and then down. Again, when you go up, you inhale and down. Exhale. Up, inhale. Down, exhale. One more. Inhale. And exhale. And go ahead, relax your legs straight. Relax your back. Relax your arms. Feel the ground underneath you. Feel the weight of your body on the ground. Couple of deep breaths here. And slowly you can get up. All right. So I think I'm done showing all the poses for pelvic floor women's health. If you have any questions, I can answer.
I do have a question, Palak.
Sure.
First of all, thank you for walking us through these steps. And then while doing those, we can feel where the pressure is, and it's a positive
Right.
pressure. So, do you
Right.
think people who have the issues with pelvic health
Mm-hmm.
do get reduced or addressed by these poses? I mean, does that happen really?
So it depends. Like if you don't have any issues, then this poses work as preventive. But if you have something going on, like a little incontinence or leakage or pain, pain with sex, pain otherwise, then it's a good idea to be assessed by a pelvic floor therapist before you do anything, because there is like it's amazing like how we think of our muscle gets tight, our muscle inside gets tight, and the therapist can kind of go in and kind of check it and release them for you. And then they also check the strength of the muscle inside, then how weak you are.
Okay, thank you.
Yeah. Yeah, sure. Yeah.
Palak, how many times do you recommend doing these set of exercises?
Well, I personally think at least 3 times a week we all
Okay.
should do it, because I think as we go into perimenopause, menopause, all the muscles gonna lose that strength because
Mm.
estrogen is gonna fall. You don't have the normal hormonal balance. So it's very interesting how it's like if you don't do anything, many times people just comment like, oh, I felt something fell, like suddenly,
Mm.
So if you have any family history, you want to be very careful that you make sure you do all this to prevent it.
Understood. Are are there any particular for premenopause and menopause, or the same ones apply for
Yeah,
any?
they are same. It's like, how we do for regular preventive back pain or shoulder pain, we do stretching and strength. So all this kind of includes everything. And then the way I was showing that Kegel exercise, the squeezing and lifting, that can be done many different ways. Like you can engage your core. Many times core is weak, causes your pelvic floor to go weak. So if you feel that your core is weak, so you focus that also.
Okay.
And
Thank you.
that's we all, because we lose as a woman, we lose our butt muscle the first. It's so interesting. Like we have it, but it's all fat.
Really, even I mean, I have a rather large, but this is a recorded session, so we should not speak. But so it's not strength, you're saying.
It's all not, unless you are tested, somebody tests you for strength, and you are like really good, then you are, yeah.
Hmm.
But most women, like we all kind of, our fat, our muscle changes into visceral fat. Like you may be same composition, but the amount of, you know, fat is more than the muscle.
Got it. Got it. Are these tests covered under insurance?
Like when you do the assessment for
Yeah.
pelvic floor,
Like,
yes, yes.
yeah. Okay.
Yeah. Like how you go for any other physical therapy?
Yeah.
You
So you
can
can ask for a pelvic floor checkup.
therapy. Yes. And then there are pelvic floor therapists who can do that.
Okay. Wonderful. Thank you.
All right. I guess I finished it a little bit early.
No, it was a wonderful session. Thank you. Thank you so much, Palak, for organizing this topic, very important topic. And
There is much more to it. I'll see if I can do one more and go a little bit deeper into
sure.
things, like make it a little different for PCOS or for perimenopause, menopause, menstruation, things like that,
Okay.
you
Okay.
know,
Yeah,
and we
maybe
can.
one question is there one particular for menstruation that is recommended for teenage girls or
So
someone who has
teenage,
had, yeah.
yes, yes. So one of the thing is that the one which I showed you, the Vajrasana, and then you go down and up.
Yeah.
Then the happy baby pose.
Yes. Happy baby
Yeah,
pose. Uh-huh.
yes,
These
and
two
then
are
cat cow.
and cat cow. Okay. Perfect. Thank you.
Yeah, that
That,
really is good for them.
that's very helpful. Thank you. So we do have a yoga festival coming up for those who are joining us today, and Palak is going to repeat this particular session during the yoga festival this Saturday. So if you have not seen the announcement yet, check out arvayoga.org/yoga festival, and you're welcome to join us for part of the time, the whole time. It's close to 5 hours of yoga for free in a park. Who doesn't like that? So bring a mat, get a water bottle, and enjoy some free yoga to honor International Yoga Day on June 22nd at Graham Park in Horsham. Do register online. All information is available. Is there anything else, Palak, that you want to cover?
No, that's it.
Okay. Wonderful. So a
Thank
huge
you.
Yeah, yeah. Hi,
thank
Palak.
you.
I don't have any question, but just wanted to say thank you. I
Thank you.
enjoyed the session. Thank you so much for your time, and it was very informative session. Thank you.
You're welcome. Sure. Yeah.
Wonderful. On behalf of Arva Yoga, Palak, as always, a huge thank you to you, and thank you for everyone who was able to join us.
Yeah, thank you for joining.
Thank
Bye
you.
all. Have a wonderful
Bye.
evening.